Hello, and thank you for joining us today for a panel discussion on individual coverage health reimbursement arrangements. My name is Dean Mohs, and I am a division director here at the Centers for Medicare and Medicaid Services, or CMS for short. I focus on business development and strategy with our employer stakeholder groups and private sector enrollment partners. It is my pleasure at this time to introduce you today to our panel moderator, Randy Pate. Randy is a CMS Deputy Administrator and the Director of the Center for Consumer Information and Insurance Oversight, or CCIO. In this role as the CCIO Director, Randy leads CMS's work on the individual and small group markets, including the health insurance exchanges. With that, I'd like to turn the call over to Randy.
Thanks, Dean. Appreciate it. And I want to thank everybody for joining. And I also want to thank our panelists for joining us today. So big welcome to all of you, and thank you for participating in the event. So I want to go through and introduce our panelists real quickly. We have a great lineup. So I'll start with John Barkett. So John is Senior Director of Policy Affairs for Willis Towers Watson. John's responsible for strategy and development related to federal and state health policy, as well as the product development and marketing of Willis Towers Watson's various marketplace solutions, including HRAs. Next, we have Annette Bechtold. She's Senior Vice President of Regulatory Affairs and Reform Initiatives. Annette is responsible for healthcare reform initiatives, compliance, and strategic development at One Digital. She advises, educates, and supports OneDigital's overall corporate tactics and client support issues. Welcome, Annette. And we also have Victoria Hodgkins. She's the CEO of PeopleKeep, a longstanding advocate for an innovator in personalized health benefits. PeopleKeep offers HRA administration software solutions, including an ICHRA platform that automates ICHRA benefit creation, compliance, and ongoing management. And then next we have Jack Hooper. So Jack is the founder and CEO of Take Command Health. Take Command provides easy to use software for employers and benefit brokers to set up and administer ICHRAs around the country. Jack is a believer in the ICHRA model and its ability to spur innovation and use change in the healthcare landscape. So welcome, Jack. And then we have John Kelly. John Kelly is founder and CEO of NextBen, provider of an advanced digital insurance marketplace designed to help companies of all sizes simplify the process of buying and selling health insurance. So John's singular passion is to finally and permanently fix the entire health benefits experience, bringing it into the 21st century and leading it beyond as the industry evolves. Then next we have Michael Levin. He's the co-founder and CEO of Vericred. Vericred is a data platform simplifying the exchange of health insurance and employee benefits between carriers and tech companies. So Vericred's data solutions enable quoting and decision support, as well as enrollment and member management. And next we have Cathy Mahaffey. She's the CEO of Common Ground Healthcare Cooperative, a nonprofit health insurer serving individuals and small employers in Wisconsin. CGHC employs 105 staff in 2020, and they implemented an ICHRA for their out-of-state employees. They're using the lessons learned as an employer to educate other small businesses in Wisconsin about the benefits of offering an ICHRA. And next, we have Brad O'Neill. He's the Chief Executive Officer for Golden Bee Advisors and co-founder of www.ichra.shop, where employers can shop, enroll, and administer health insurance. Mr. O'Neill serves as a board director for the Colorado Public Benefits Corporation for Connect for Health Colorado. Mr. O'Neill was recently named as the Insurance and ICHRA Director for the Valley Health Alliance, a community-based health provider-led coalition in Aspen, Colorado. Next, we have Kat Perez. She's the co-founder and chief product officer of Health Sherpa, a website and team of people helping people to find, enroll in, and use ACA health coverage. Kat leads a product strategy and innovation for Health Sherpa's marketplace enrollment technology, including a strong focus on ICHRA shopping and enrollment solutions for employees, TPAs, HRA administrators, employers, benefits brokers, agents and brokers, carriers, and more. So welcome, Kat. And then we also have Chris Rocky. He's the Vice President of Product Strategy and Innovation at Allegius. In his role, Chris is responsible for Allegius platform strategy, and product development, where he works closely with Allegis clients and partners studying market dynamics, business opportunities, and consumer needs. As a consumer-directed healthcare advocate, Chris brings more than 15 years of tax-advantaged account administration experience to clients, partners, and the employers and consumers they serve. And so last but not least, Jonas Sauve serves as the Senior Director of Product Management at Discovery Benefits, a WEX company. His work focuses on delivering innovative products and features to brokers, employers, and employees, including an emphasis on ICHRA product strategy and future development. So that's our panel, and welcome to all of y'all, and we're really excited to dive in and really hear your perspectives. So with that, I'll just dive right into the questions we have. I want to start with kind of a broad question, and I think probably Jack, maybe you could kick off responding, and then we can follow up with a couple of other questions and bring in a couple other panelists. But the question is, what are some major factors a business owner should consider when evaluating whether an individual coverage HRA or ICHRA model is a good fit for their company?
Thanks, Randy, and thanks, Dean and CMS for hosting this, and excited to have this discussion with the other panelists. So if you're an employer, what is ICHRA something we should consider? I wrote down 3 things that I think if I was a business owner or employer, I would want to look at when making a decision on ICHRA or not. The first is the state of the individual market in your area. There's parts of the country where the individual market is really flourishing and doing very well. And your employees, transitioning to purchase their own plan, they're going to have a lot of great options to choose from. There's a few parts of the country where I'd say it's okay, and then some where it's still struggling. It can be a little bit more expensive. Maybe the networks are a little bit more narrow. So that's the first thing, is to be aware of what options your employees would have. And there's some pretty easy ways to do that. If you go to HealthCare.gov or your state marketplace exchange, there's often window shopping features. Health Sherpa is another great place. You can kind of check out options and see what's available for my employees to buy. Don't ask, I would say a lot of times brokers, especially if they're group brokers, the individual market's changed a lot in the last few years. So a lot of times they'll tell you, oh no, it's terrible or it's struggling. It's actually pretty good in a lot of spots now. So check that out. The second thing I'd consider is what do I want to achieve with ICHRA? ICHRA is great because it gives employers some real options to control costs, to really design a custom fit plan for your employees. But is that something that's going to be valuable for you? Are your employees going to want that choice? If you're over 50 employees, you have to bring in what's called the affordability discussion as well, to make sure that your offer of the ICHRA is going to satisfy the corporate mandates and make sure that you're not subject to any penalties. And then finally is the costs. And I don't just mean the cost of the plan, although that's an important part of ICHRA. You get to set the budget, unlike shopping for a group plan. But cost of that might come, organizationally in terms of change management. If you're transitioning from a group plan, we'll share some of the lessons and insights we've had later. We've seen groups transition really well, and it'd be great. And we've seen groups kind of transition lazily, and it confuses employees. And if you're new to benefits, then it can be a really great way to kind of pick up and get started, because it's very, very easy to get going. So those would be the 3 factors I'd really consider. What can my employees buy in the market where they live or where they work? Can I take advantage, or how would I want to design a plan and make sure it's affordable? And then finally, the cost. Obviously, the obvious one of setting a budget for the plan, but then as well as making sure that I'm ready to transition to something like this.
Yeah, thank you, Jack. Yeah, and those really are the big factors for business owners when they're looking at this. I want to bring Mike Levin into the discussion. Mike, from your perspective, what are the different factors to consider when comparing an ICHRA against maybe a traditional group health plan? Maybe talk about that a little bit.
Sure. Good morning, everybody, and thanks for the opportunity. Jack, you're a tough act to follow, so I'll see if I can bring some incremental value to the conversation. But importantly, it really gets to the goals of why is the employer looking at moving to an ICHRA. And it could be to offer coverage where coverage hasn't existed, to reduce costs or manage costs, to reduce administrative burden, to offer more flexibility and choice. So when you look at that in the context of versus traditional group environments, you have to kind of look at two forks in the road. Are you for the first time comparing two traditional group benefits, or are you moving from? And the latter is pretty interesting because you've got a platform in place. You've got expectations that are being set. And you have to look at things like brand, because the brands in the individual marketplace may well differ from those that are traditionally offered in the group space. You have to look at networks, which Jack touched on, because typically in the group space, networks are broader. So will your employees find the coverage that they're looking for? Will they find their doctors and preferred hospitals? You also have to look at perception. Is this being viewed by the team, by the employees, as an opportunity or as a potential degradation in the benefits they're used to? So that's one path. For the groups that are not covered, looking at how these benefits are administered versus a traditional group chassis where you might have a benefit administration platform in place. That's a key element to quite frankly, how difficult and how burdensome implementing benefits would be in a company that does not already have those in place.
Yeah, absolutely. And I wanted to have one more follow-up question on this for, I'm going to bring in Brad O'Neill. And Brad, in your advisory sort of role, what are really the most frequently asked questions and concerns you're hearing from employers when they're considering an ICHRA?
Yeah, thank you. And thank you to all, Jack and Michael, really tough to follow, obviously. But, we're in the trenches right now. We're hearing the questions from the employers. It's more of a discovery time right now, and it's a new concept to them. So a lot of those typical questions, questioning where it came from, looking back at the legislation, discovering that part. But I think right now we're seeing the business owners are, across the country are struggling from three things, right? It's the cost of healthcare, it's the time and cost of administering healthcare, and then third is we have employees that we give these great benefits to, and it's tough for them to comprehend and navigate the system. So I think what we're hearing right now is kind of a surprise that we can really hit all three of those buckets with ICHRA. It really gives us an opportunity for the employees to understand things better, to have more choice. And I think employers like that. So I think some of those questions, the burning ones we're getting, right now about COBRA, how does that work? We're seeing a lot of seasonal employees with that. But I think overall, the questions we're seeing right now are kind of enlightening. How can I use the different classes? What's my contribution look like? And overall, when can I get started? From the new groups that have never offered insurance before, as was mentioned before, this is a great tool. But I think more of the traditional groups, I'm self-insured. And as we look at the self-insured groups, I kind of go back to that second bullet, the time and cost of administering healthcare. Businesses, I think, are asking the question right now, and I ask it, did you get into your business today to really be an insurance company? And as we get into self-insurance and more complex benefits captives, those larger groups right now are looking for something else. And I think that ICHRA is providing that. So the questions that we're getting, I think, are enlightening, that we're giving good answers to today.
That's great to hear. And obviously there are a lot of questions at the beginning of anything new like this, but it's good to hear that you're really getting those answers out there. I want to ask a question to Annette, and in your strategy role and how you think about the future of this, and even right now. I mean, based on your experiences, what you've seen with ICHRA so far, what kinds of businesses do you think make the most sense for in terms of their size, what industry they're in, maybe where they're located?
Thanks, Randy. I'm probably going to piggyback a lot off of things that, Jack and Brad and Mike provided, because I don't know that it's a one size fits all, but that's also kind of the beauty of the HRA, is that it does give this more breadth for employers, right? So there's not really a magic number. I think it's based more on a few things. So like Jack said, why are they offering benefits to their employees? What are they trying to accomplish with their benefits program? That's really important. Also, their funding types, if they're nonprofit versus for-profit companies, and what are they doing with their benefits and what are they trying to achieve? I think also the expectations come into play. I think Mike talked about that. What do their employees want? What don't they want? I think high turnover industries are interesting when it comes to maybe this not one size fits all type idea. So I know that a lot of hospitality, et cetera, a lot of people who have maybe not so much with COVID now, of course, that was pre-COVID, like your restaurants, those types of things who have wait staff, or just some of these businesses that have natural class differences in them, maybe some that have large seasonal or populations that do something completely different in a completely different location. So I think geography is one. Where is the business located? If you've got a big concentration in one particular area, but you have straggler employees in a whole bunch of different states or localities, this provides some unique opportunities to provide maybe a more cost-effective strategy for those individuals outside of the main area, and better solutions for them, frankly, and lower cost. So I think a lot of those cost, definitely the expectations. And I think, Brad touched on this too, which I think is so culturally important. The administrative piece, the administration is not only going to be now for the employer, but it will be for the employee who may or may not be equipped to, or who might have no experience in shopping for coverage. And, the employer's done that for them all of this time. So all of these components, I think, are equally important to weigh for an employer to decide, is this the right solution? And I can't emphasize probably enough the fact that there needs to be a lot of time taken and care in exploring all of these different areas with employers on the front end before saying, hey, let's dive in. I think the big piece here is really, again, these natural classes like I talked about. If the business already has natural employment classifications, this solution becomes much easier to implement. It's not, how can we carve it up? And I think I just have to share, because I do a lot of compliance, the one big question around classes we get so much is, hey, can I put in an HRA for people who are Medicare age? I think that's like the number one question we get all the time. And, of course, the answer is no, but, because there are many rules, like the equal benefit rule, where you have to offer the same group health plan. You can't take Medicare entitlement into effect when you're deciding what to offer people. But there's a lot of things people are trying to solve for and think about. And I think all of these things are good conversations to be having.
So Annette, that was an awesome answer. You raised a lot of important issues, and hopefully we can delve into some of those, I think, in the remainder of the discussion. But one thing you just raised was about the classes, and I want to bring in Victoria here to talk about this. So, in the final rule, in the June 2019 final rule, there are different classes, employer classes that employers can use to decide whether they're going to offer a particular class in HRA versus maybe a traditional group plan. So Victoria, can you talk a little bit about what employers should consider when they're wanting to use different classes, with their individual coverage HRA?
Yes, thank you, Randy. Well, I would echo Annette's points that there are some sort of natural classes that emerge, and we're seeing some key trends. So one frequent use case we're seeing is companies with distributed employees across multiple states. And Annette touched on that, but I think an example might be really helpful. So we're working with one company who's in the mortgage servicing business, and they have under 100 employees, but those employees are in 11 states. So their traditional group plan is very complex and pretty costly. So when they're designing an ICHRA benefit, they can create a state-by-state class for those employees distributed across the 11 states. And that does, that's a terrific solution. It does a couple of things for them, and this will be a bit of a repeat. But first of all, their allowance allows employees to go get a silver tiered plan, which is comparable to their group plan. But then those employees can go really find the plan that best fits their needs and gives them a local network of healthcare providers, which we've talked about. And then in this case, the company is saving 20% versus their group plan. So for employers with distributed employees, or they have headquarters in one state and a few people in other states, ICHRA is a terrific solution for them. I would say the other most frequent use case we're seeing is when an employer wants to provide an allowance for salaried workers and an allowance for hourly workers. So they want to provide a benefit for all full-time employees, but if they put more money towards the salaried workers, they feel they can provide a more robust benefit for a group of employees who is A, more likely to participate in the benefit, and B, values robust health benefits towards recruitment and retention. So we're seeing that across lots of different industries, verticals, but I will say there's an interesting trend where we're seeing nonprofits use these two classes. So even smaller nonprofits who have fewer than 50 full-time employees, they're not subject to the employer mandate under the ACA, but they're philosophically, right there in terms of saying we should provide a benefit to all full-time employees. That's important to us, but we have a limited budget. So if we have a salaried class for our kind of executive team and an hourly class for our staffer team, we can take our limited budget and put more money towards the salary class and have that sort of go further than if they had to do it across all full-time employees, regardless of their salary status. So I think those are two common uses of the 11 classes, which you can mix and match, right? You can add state and location to other classes, but those are two frequent use cases we're seeing.
Yeah, absolutely. Full-time, part-time, employees located in different states, seasonal workers, these are all sort of, and a lot of times these are groups that may not have necessarily received, health benefits from their employers in the past. So it's pretty exciting when you think about opportunities to offer, some of these folks coverage maybe for the first time. So I want to ask John Barkett as a follow-up really on this thought is, talking about, making the decision of whether to offer coverage at all, to your employees and to what employees you do that. To what extent, might an ICHRA make it easier for the employer just to jump in and offer benefits to their employees?
Yeah, thanks for your question, Randy. I think the way that offering an ICHRA makes it easier for employers to offer health benefits to their workforce is by simplifying what you have to do to offer benefits. So, for example, you no longer have to administer a health plan. That's a lot of work for employers, and it does vary depending on how big you are and what type of healthcare program you're running. But there are decisions every year that employers have to make. Do I need to add a wellness component? Do I need to add an HSA? Do I need to do new training? Do I need to change my benefit design? How do I manage the costs? That is a lot of work, and I'm leaving out a lot of other stuff as well. And that goes away when you move to an ICHRA. Second thing I'd say is you really have a much better handle on costs. The volatility of being the purchaser of health benefits goes away with an ICHRA. So if you happen to be a small or medium-sized employer and you had a bad year one year because someone in your company, say, had twins that spent a lot of time in a NICU, and you start to have to see your rates go up because that was a really expensive case. You're no longer in that situation when you move to an ICHRA because your employees are buying coverage with everybody out in the individual market, which is typically a much larger pool of people. I'd also add, this is not often one of the top line points, but for employers who have high COBRA costs, COBRA isn't even really part of this anymore, or at least you have to offer COBRA with your HRA, but your people are enrolled in individual plans, they're not really staying on a group plan anymore. And I think for employers who have a problem with COBRA right now today, I think that's going to be an important point for them. Last thing I'd say is there are certain employers who struggle to offer benefits because health insurers who are potentially going to be their health insurance company say, well, I want you to guarantee a minimum number of people will enroll in my plan. And if you want to offer choice of a couple of different insurance companies, that might be hard to guarantee the minimums that these health insurance companies are demanding. With an ICHRA, that's no longer a problem. Your folks can go out and choose from whatever carriers are offering in the individual market. And those carriers don't care if one of your people chooses them or if all of them choose them, that they'll still be offering those plans for your employees to enroll in. So those are three ways that for an employer, offering an individual coverage HRA might be simpler and easier than offering group coverage.
Thanks, Sean. And I want to also ask Cathy Mahaffey, since you're the CEO of a nonprofit health insurance company, but you're also an employer, and you made the decision to move your employees into ICHRAs. Anything you can talk about in terms of the ease of transition and what to look out for there?
Yeah, absolutely. I appreciate that. I wanted to share our personal experience because we have moved a segment of our employees, as you said, to an ICHRA. And I think what's really interesting is we are a health insurance company. So I made an assumption, right, that our employees would know how to buy health insurance. And that was a really good learning because they don't. Because, as was stated earlier, employers have been buying health insurance for their employees for years, right? Here's your plan, here's your doctors, here's your benefits, and here's what you're going to pay. And so it was really a fascinating experience for us. And I can't stress enough, Jack's comment about change management. I really believe in the ICHRAs. I think that potentially they could be our future for healthcare, given employers have had issues over the years of like, why are we in the health insurance business? Why is your health insurance tied to your employment? It doesn't make sense if we really take time to think about it. But so for our experience, though, is that, we did know our employees struggled. How do I buy health insurance? I've never done this before. So the lesson there is I would really tell employers, make sure you have assistance to support your employees on how to buy health insurance. What are the things that they should look at? Also, it is hard for employees to think, I had one employee say, I don't think I can work for a company that doesn't offer health insurance. So getting them over the fact that you're still getting a benefit through the employer. So just changing that relationship. But I can tell you, after we did this and went through all of those difficult, times in the beginning, our employees love it. So it's really getting over that hurdle and getting over the employer thinking, well, I lose employees if I, don't have a group plan and things like that. Our employees love it. Thank you for letting me choose the benefits that fit my family. Thank you for not telling me what providers to use. So thank you for the choice. And so it's been a good experience for us, from that, and a lot of lessons learned. But it takes some courage for employers to do this, and also to do it right. I think using experts, using a lot of the resources that are available, and all the lessons that we've learned as employers, in the early stages to do it to the best that you can.
Yeah, that's awesome, Cathy, that you guys are doing that and you've had so much success with it. But you kind of finished by talking about, the tools that are out there, and so I want to follow up, with Mike Levin, like John, you're involved with providing a platform, for employers to use when they're setting up ICHRAs and trying to handle, all of this change management. Can you talk a little bit more about, what the solutions are as you see them and what tools you all are offering?
Yeah, so we kind of sit behind the scenes. We're not actually building the tools ourselves. A bunch of the other panelists here are actually building tools that are group facing or individual facing. And what I can tell you is that this is still early days. There's a lot of innovation going on here. Innovation focus on the groups and helping them navigate, is this the right solution for all or part of their company? What should they be considering, and helping them do so in very programmatic and analytical ways so that they can achieve those goals that they've set out. And then for the employees, there are great tools that you all have built to help individuals navigate this market, navigate choice. I mean, choice is good, but it also is confusing, right? How do you choose from the 130 different plans that are available in your area? How do you make your way through that? Well, you all are doing that, and more is coming. So, I mean, part of my excitement, quite frankly, about being part of this panel is there's so much innovation going on in this space, and it's not apparent yet. But it's happening. So, you know, I think as this matures over the next year or so, you're going to see new products, new platforms, new decision support tools, new administrative tools for all those involved to help through this transition. This is a really fundamental time in our industry. I'll also just step back and echo something that Cathy said. Personal experience, we are 45 people full-time here. We just opened an office in Omaha, Nebraska. We have 5 people out there. Do you know how hard it is to get a separate plan in Omaha, Nebraska from a New York plan? We had to go through approvals from the local Blue, getting an exception from the Blue in New York, so that they could cover people that they don't have as covered members. I mean, this is the craziness that we all and other employers, and particularly smaller employers, can avoid by moving to ICHRA. So I'll get off my soapbox and turn the microphone back over to you, Randy.
It's a great soapbox to be on, and you know, I think you're exactly right. I want to drill down a little bit on this. You know, part of the goal of the whole rule was to insure more people, and you know, in the final rule, we estimated over 10 years about 800,000 people would come into ICHRAs and would gain insurance coverage through that. But then, you know, with the pandemic, I think now we're seeing it's even more important for that link, you know, for people to have that link to the healthcare system through health insurance. And it's, you know, I know employers want to provide that to their employees. So I want to start off with Victoria and just ask you, if you're an employer and maybe you're not offering coverage and you're thinking about offering it for the first time, you know, is an ICHRA a good way to start, and kind of what factors should they look at?
Yeah, we work with a lot of employers who are first time to benefits. And I would say health reimbursement arrangements, whether QSERA or ICHRA, are often a really great entry point. As many of the panelists have said, one of the key advantages is that HRAs can be very simple. So first of all, the concept of a tax-free allowance, that's pretty easy to understand. But then you can also budget for those allowances, even if you've never had to forecast this type of expense before. You're the one setting the budget, not the group plan. So you don't have to think about percentage rates and contribution levels. So that can make it easier to start, kind of lower the barrier. And then once you get to the next year, it's again, kind of, you have more budgetary certainty. You're not waiting for the rate increase from your group plan to do your budget. So for a lot of the employers we work with, this is a terrific on-ramp, a way to get started with health benefits because of that budgetary certainty and just that simplicity. And then secondly, I would just echo what a number of other people have said. You know, a lot of businesses don't want to be in the business of selecting health plans. If you've never done that before, and if you're small, you may have, you know, an HR person, but you're not likely to have a benefits specialist on staff. Kind of working your way through selecting health plans can be very time consuming and complicated. And that can be a barrier to starting to offer a benefit. So with an HRA, you're shifting. You know, a lot of employers really like the idea of shifting to making their employees not only users of the healthcare system, but consumers. And yes, there is an education component there and an expectation component. How do consumers find the right insurance plan for them and their families? But employers really like that concept because it creates ownership with the employees and it gets them out of the business of thinking about health plans and in whatever business they got into to start with. So I think HRAs, those are two big advantages. I'd just like to touch for a second on the disadvantage of HRAs, which is frankly, a lot of employers don't even know that these options exist for them. So we've been, advocates at People Keep for a long time that HRAs are a great entry point into health benefits, both QSERAs and ICHRAs. And frankly, it's really hard to educate the market. So I am really grateful that CMS is hosting this panel today and helping to get the word out so that employers realize that they are different alternatives and that maybe an HRA would work for them as a starting point, because we want to get employers off the starting blocks and into offering health benefits.
And, speaking of awareness, especially for small employers, there's the ICHRAs. They actually started on January 1st of this year, so they're brand new. But there is another option out there in the HRA space for small employers called QSERAs, which is a long acronym, but that's been out there for several years. And I wanted to turn to you, Annette. You're really good at explaining some of the complexity here, but just wanted to ask about, if an employer, small business is looking at a QSERA versus an individual coverage HRA or ICHRA, could you talk about maybe the pros and cons involved in that type of decision?
Sure. They're a little bit different. I mean, they are both kind of on this HRA platform of you're reimbursing something as the employer, but and kind of going off of what Victoria said, thinking about it from an easy standpoint versus a more difficult standpoint. So if you're a small employer, meaning you have less than 50 full-time equivalent employees, you have a choice of either one of those. You cannot choose the HRA if you have more than 50 full-time equivalent employees. I think the biggest things, from an ease of administration, if we think about the QSERA, it's much narrower. You think of it as being just a much narrower, you have to fit in a much smaller box in order to be able to provide it. But because of that, there's probably less things you have to do. So there's some more simplicity. So for example, it's very defined how much you can provide on an annual basis. If we're talking about a QSERA, how much can you provide? Saying there are limits that get changed annually. There's also the confines that it can only be offered to full-time employees. So if you're looking for something for your part-timers, QSERA is not going to work for you. So again, full-time. So again, we keep making this box a little bit smaller, but it provides some availability. I think if you look at your workforce, if your workforce primarily would be normally eligible for premium tax credits in the exchange, this coordinating with that only happens in the QSERA. It's prohibited if you have an individual coverage HRA. So under the ICHRA, if you offer that, people are no longer eligible for the premium tax credit. Where in the QSERA, and if that's most of your population, whatever you offer offsets what they would get. But if it's not all of what they would get through a premium tax credit, they would be able to get the difference and still have that available to them. And so I think that's a really huge piece. I think some of those are some of the big pieces, I would say, on the QSERA. So again, having somebody help you go through all of these nuanced differences of what fits for me and my population, I think is really the key.
Annette, would it be okay if I added on a thought?
Absolutely.
Because we've been doing qualified small employer HRAs for a long time. I would say one other factor that a small employer considers at times is whether or not they want to have a benefit for all employees, regardless of their insurance status. So in a QSERA, you can offer a benefit to folks who are on their parents' plan or their spouse's plan, albeit with a different tax treatment towards the allowance. but we find some employers really like that idea of inclusivity, that I can offer a benefit to all my employees regardless of their insurance status. Other employers really want to limit it to, I just want to offer it to people who should go get their own insurance, and I'm not interested in a benefit for folks on parents' plan. But QSERA lets you do that, and that is sometimes a factor in the employer's decision-making.
Victoria, that's huge. And I did fail to say that. So I'm so glad you added it, because that's part of that easy part. I don't have to figure out who has what, you know, all of that kind of thing. So yeah, you're right. That's another critical factor.
Yeah, thanks to both of you for that great information. Wanted to, you know, we talked about the pandemic is coming up in a lot of these different discussions, but when you look at the current market conditions, I want to ask this question to Jonas first. But when you look at the current market conditions out there, including the presence of COVID-19, you know, how is that impacting employers, you know, interest in HRAs for the near future?
Yeah, absolutely. Thank you for the opportunity to be here. So with COVID, we've really seen that be split really up to two buckets, right? So you have the employers who are taking the approach of there's already so much change, I'm not willing to introduce more change into my employees' lives at this time because of the impact of COVID. So really one bucket of employers are looking to maintain the status quo per se, whereas another bucket of employers, particularly those who have been significantly impacted by COVID, right? It's a very challenging business environment right now. And so they need to weigh all of their options that impact their bottom line. And of course, benefits are a major component of that. So, you know, the ability to set a budget, predict future costs, reduce administrative burden, those are all things that are really attractive to people or employers who are impacted by COVID. So, and HRA is definitely a potential difference maker for employers and could be an accelerator of adoption. And also, you can't really talk about COVID without talking about unemployment and the impact, of course, it's had there, right? So compared to the beginning of the year, in recent years, we're in a much softer labor market. Now numbers have gotten better, but it's still much softer than it was before. So when you think about an employer's ability to recruit and retain employees, right? If with a softer market, there's less concern over rolling out a new benefit that might be less familiar for people, or to, I believe, Cathy's comment earlier about you're not for your group health plan. Well, you are, but you have that perception to overcome, right? And so there's always risk with that. And so with the softer labor market, you're facing a little bit less risk. You can maybe more comfortably make a transition to an ICHRA. On the flip side, for smaller employers who have seen turnover or layoffs because of COVID, someone already mentioned the minimum enrollment requirements for carriers, right? So that impact might reduce your ability to get group health coverage, and because of that, ICHRA might be a good solution for you. But the reality is 2020 has been the year of change. It's going into 2021. As we return to normal isn't the normal we knew before, right? And everything is changing. So I think that as the dust settles from everything happening in the world today, we can touch on a couple other market indicators here in a bit, but definitely anticipate that ICHRA adoption will increase because of that. But I'll pause there, see if Cathy wants to jump in at all on the COVID piece.
Yeah, I really think you hit the high marks there, and COVID is impacting all aspects of our life, and this is no exception. And I would just say that perhaps as employers start to recover in the future from COVID, and maybe they did have to end their group health plan as a result of their economic situation, that maybe I think there might be more interest in ICHRAs as employers recover, especially employers in those tough markets like retail or restaurants, service industries. So I think that there could be opportunity, again, in that recovery phase of COVID.
Cathy, one quick follow-up. I mean, as the CEO of a nonprofit health insurer, you're in this market offering coverage. So, a lot of employers, if you're not necessarily tuned in to what's going on, you might think, hey, COVID-19, that's going to make the costs go up. The premiums are going to spike, or I'm not going to be able to find something affordable. Can you talk a little bit about that and maybe, what's going on in the market and the individual market where people would be buying this coverage?
Right. So I think you're absolutely right, Randy, where, employers are concerned. There's no doubt, especially large employers, right, who might be self-funded, level funded, where they're very concerned about the impact of COVID on their health insurance costs. And, in Wisconsin, certainly the COVID cases are rising significantly, and we continue to hear, concern about what's going to be the impact on costs. And it's very difficult to predict that. It almost just has to happen, and we have that experience. And so that is on employers' minds. It's on, they're concerned about all aspects of their health insurance and how that could be impacted. And so, I think in the individual market, right, there is some protection there, right, where, if you're an employer of 55 employees, that's your pool, and impact of COVID could be, greater to that employer versus being part of a large, individual pool of, tens of thousands of members that, like, for example, we have in the individual marketplace. There's maybe a few more protections there. So I think that, as employers have these experiences with COVID and it impacts their costs, I just think that's going to propel them to look at other options. They may just find, their costs for their group plans just to be completely unaffordable, and they're just forced to look at different options. And again, if they, in Wisconsin, their carriers are returning. It's a very robust market. So, I think that there are great options for employers here to start to think about that change and how they can manage costs better.
Yeah, that's a great answer. Really appreciate that. So as we talked about, ICHRAs are new on the scene as of January 1st of this year. I wanted to turn to John Kelly and just ask, as you've seen what's going on out in the market, what are the biggest lessons learned so far? And it's not even been a year yet, but as we get to the end of 2020, what are the biggest lessons so far you've seen in this?
Yep. No, thank you, Randy. I would probably say one of the biggest lessons we learned is building off of what Cathy just said there. It's not just for small employers, 50 and below. We're seeing a real trend in the 51 to 300 space there too as well. So a lot of employers who are maybe dealing with the COVID, as Cathy said, they may be self-insured, they maybe didn't get the rate increases, it becomes affordability for them. So, it's probably the biggest misconception we saw was that it's only for micro and small employers, and that's not really the case. We also see, though, that savings, as Cathy alluded to, when you start getting into the 51 and higher and the self-insured, or whether they're fully insured, they're not seeing they're seeing savings. So what Victoria said earlier about, a multi-state group see 20%, we're seeing on average 20 to 40% savings in that space as well with those employers. So that becomes very attractive as well to those employers. So, but also another interesting piece that we really see too is because of it is defined contribution, employees can buy, take employers' monies and make purchases. We're seeing a bigger uptick in the younger employees. So now, it being age-based rates, a younger employee, it's gonna be cheaper than what maybe a traditional group plan would be. So we're seeing an uptick, especially in the under 30, but also in the 26 and under. They're basically, out of pocket for their premium. We're seeing about maybe 10 to 20% is what they're paying. So any type of contribution from the employer is pretty much taking out almost 90% of the premium for that younger employee. So we are seeing younger employees and a much higher participation rate. But also too, when we look at participation rate from the whole group, we've heard that most employees and our panelists here have done a great job. It's about change management. People aren't going to participate in this. We're actually seeing with the groups that have been doing this, we're seeing about a 66% adoption participation rate. National average about 65. So it's pretty equal. It's pretty equal. So we're not seeing the downtick that, it's going to be, disrupting to employees, but it is also about get it out in front of it. It is different. It's moving from a defined benefit to defined contribution, and how do you explain it? So it takes a little bit of time, a little bit of understanding. It is a change, but employers are, they're able to, they see the savings, and everyone thinks, so this is savings going to the employers. No, it's being passed on to the employees as well. So both the employers and employees are seeing that savings being passed on. So it does work out pretty well for everyone.
Thanks, John. I wanted to also ask Kat Perez to weigh in from the Health Sherpa perspective on those questions of, what we're seeing in the first year in terms of lessons learned.
Yeah, thanks, Randy and John touched on some really great points. And I have to say a lot of other folks on this panel have touched on some points that I'll probably reiterate in terms of our learnings, but still obviously very early. So a lot of this is incredibly anecdotal, but there are three primary things that we've come away with since January in this effort. I'd say the first one that everyone is just talking about is figuring out payment solutions. So as you think about how kind of folks work together and partners work together there to make that experience as seamless as possible for the employee versus putting that additional kind of burden and responsibility and knowledge on the employee, that has come up time and again. So employers in particular are looking to as close of a list bill model as possible, and really just kind of sending that payment directly to carrier. So I think that's the biggest one that we've seen on our side, knowing that there is solutioning and conversations happening from a lot of folks on this call and just partners in general, to really solve for that, because that's going to be key just in terms of making sure that employee stays in that coverage, has that coverage, and everything is kind of handled behind the scenes. So exchange of money, seamless, automated, that's a big one. I'd say the second one that we've experienced, and it's something we didn't quite anticipate or didn't know enough about, but off exchange is increasingly becoming an important factor in the experience. So there's certainly the concept of on exchange individual coverage, but as you kind of introduce Section 125 cafeteria plan, salary reduction deductions rather, you're looking at an off exchange shopping and enrollment experience end to end. And so that is going to be super key. That is a big learning that we've had. Just a rough number, about 75% of the groups that have adopted HRAs, at least on our side through our partnerships, have those cafeteria plans in place for those premiums. So that's going to be key because you're going to want to provide an unbiased kind of shopping and enrollment experience there. And then I think the third one is an obvious one, which everyone has touched on, particularly, I know Annette earlier on touched on this, Cathy, even Victoria and John, you touched on this a bit, but there's going to be just a level of education and guidance that is going to be so key. There's just the fundamental gaps in knowledge around just insurance and decision support and how to make that call for yourself or for your family, both from a financial perspective, but also from just a coverage perspective. I mean, a lot of factors play into that in terms of plan design, but add in this new ICHRA benefit, add in the concept of affordability, other things that you might be eligible for through the marketplace, Medicaid, CHIP, et cetera. Add in the concept of on versus off exchange. Is the ICHRA benefit offered to just the employee? Is it offered to the employee and their family? If not, what does that experience look like? So clear guidance on just how to navigate ICHRAs and making that, again, as transparent as possible, baking all the logic into the solutions and the experience with the brokers. I think that's just going to be so important. So that's a big one that we certainly has become more and more evident as we have talked to partners in the space.
Kat, you raised a lot of important points there. And I want to make it maybe a little more free flowing here if we can hopefully avoid, talking over each other. But One thing you raised was around the payment, issue for the employee. And when I go back to, I think back to January, we held our industry day, right when this whole thing had kicked off. And that was an issue that came up then, particularly around the first payment, the initial premium payment, which the employee is maybe having to pay out of pocket before they've gotten the ICHRA sort of set up and then the reimbursement flowing. I want to open it up, what you're hearing about that, whether it's, you guys at Health Sherpa or others, what you're hearing about it and, what solutions, you've been able to think through during this first year.
I can jump in there, Randy, and happy to share just a quick story so that people, watching this and considering move to ICHRA can understand what that means. At Take Command, we call it the payments iceberg because we talked about it in the industry, but with some of the early adopters, didn't know what it would really look like. I'll share a quick example of a client we had in California. It was a 80-person furniture manufacturing firm company, and all excited about ICHRA. Looks great on paper. Really good job communicating. The company did a great job communicating to the employees how it would work. We had an enrollment day. Everyone went through and picked out their plans, was feeling good about it. This was this time last year, so kind of late November. All of a sudden, everyone's credit cards got run, and our bank accounts got drafted for the health plans that they had chosen. But the reimbursements weren't going to come until January. So now we have a real problem where employees are having to float that payment, for 3, 4, 5, 6 weeks, and that can be really uncomfortable. So there are some unique solutions out there, that involve kind of list billing or payments. It's still very nascent. If you're an employer considering ICHRA, I think you've got to watch out for this iceberg and careful coordination and timing to make sure that when your employees enroll in a plan and when those bills are going to run, working with the carriers, making sure we understand that in your market so that we don't run into this problem. We did see that after a month or two, after things kind of sort out and all right, the carriers pull their fees on the same day, we're able to time that with the reimbursement so that employees aren't floating payments. That first one can be tricky. If I can add two more things, Randy, on the experience, I want to echo what others had mentioned. One thing to add there, I think, is early lessons learned. Despite those hurdles, despite those icebergs that have to be navigated around, employees love ICHRA. And I know a lot of employers, because we've worked with them this year, they're on their fence, they're nervous about being early adopters, they don't want to rock the boat. As a few panelists had mentioned. But once employees figure it out and they realize, I can buy a plan that I want, that has my doctors and my kid's prescription. And you know what? And if my company is offering me, let's say $500 and an ICHRA, and I buy the $300 plan, I can save some money for medical expenses. Now when I go to the doctor and get a prescription, it's not a copay, or a co-insurance that's spread out on a lot of little things, but wow, I can get my prescription reimbursed. I can get my doctor visit reimbursed. If I need glasses, if I need, diabetes medication, it feels much more personal. But to get to that state, it's all about the change management and, a tale of two companies. We've seen some, roll it out where it's a bit of a disaster on the communication. We had one client, I don't think they meant to do it this way, but their first email to employees announcing it was, we're canceling the group health plan. And that just, oh my gosh, employees, they didn't read anything else about all the benefits. They panicked of, oh my gosh, the benefits are going away. Versus another approach, similar company, same location in the industry, actually, had a very thoughtful approach of, hey, we're transitioning, health plans where now you have more choice. You can find a plan with your doctor. Here's someone to help you through that process. Man, that went so much better. And we got to that happy employee state much faster than kind of the first example there. So just really want to highlight that as an important learning. If you're looking to start an ICHRA and you're new to benefits or transition, it's new out there, but using experts and advisors, a lot on this call that can help you through that process it'll be worth your time.
Thank you, Jack. Appreciate that. And I think you just talked about, with the expertise out there for employers who are looking to get started. I wanted to ask first to John Barkett, if you could talk a little bit about, that type of expertise, what's out there, and then also I'll follow up with Jonas on that question. But John, you want to kick that off?
Yeah, thanks, Randy. The question was, what type of expertise is out there to help employers administer an ICHRA? And I want to just sort of start by, before I get to the answer to the question, by sort of stating what it is that employers would be doing leading up to the ICHRA going live. They would be understanding the cost of the health plans that their employees would be facing and setting a budget for how much money to be putting in their HRA that they're setting up. They'd have to understand the timeline of going live with an ICHRA and devise a way of managing the change from current day to and through open enrollment. They have to understand who they wanted to offer ICHRA to. Some employers may have an option to only offer it to certain classes, and you're going to offer it to whichever class you think an ICHRA will help retain or attract new workers. So you got to think through that. And then finally, you want to understand what steps you're going to take to set up your employees for success when they're shopping for coverage, because many of them will be making this choice for the first time. So given all those big important things to plan for, it's really crucial that as an employer, you're not going to know how to do this. No one knows how to do this. ICHRA is a new thing. You, as an employer, you should go and get help. And help is available from the industry that is rising up right now around ICHRA. We're talking about brokers who are offering ICHRA advisory solutions, consultants who are offering the same, or standalone ICHRA vendors or solutions providers that can take you from end to end and get an ICHRA solution implemented on behalf of your employer. So those companies are out there, and a number of folks who are on this call could probably help you, point you in that direction. But yeah, talk to your local broker, talk to your consultant, do a search, get about who's offering ICHRA solutions, and all of the people in this industry have already thought through how to walk an employer up to the point where they're offering ICHRAs. That's how I would think about it.
And Jonas, you want to jump in on this one?
Yeah, absolutely. So I think you nailed it. Brokers, consultants, third-party administrators. Kind of going back to the current industry or what's going on. I think people's approaches are really varying, right? You're seeing some brokers and consultants being really proactive, and you see some kind of taking that wait and see approach as well. So there's definitely a variance there. So you're going to find someone who's proactive with it, or you could go straight to third-party administrators, of course, as well. There's always benefits attorneys. There's teams that are firms that specialize in benefits compliance, and particularly ICHRA. I definitely know some that are out there. So just a ton of resources. And just to reiterate, everybody on this call, we're here for a reason, right? We're talking about these things every day. But John talked a little bit about those decision points kind of at the upfront of considering if you're going to offer an ICHRA. And just kind of hit again on the individual market and, how it is in the regions that your employees are in, and what options they're going to have available. I just want to highlight, kind of go back to Jack's point about the individual market improving from where it was to what it is today, right? We're 7 years in. Carriers have had that much time and that much data to figure out how to price products, what to bring to market. And so, looking at some data on carrier availability in different states was about 3.5 per state 2 years ago in 2018 to 4.5 this year, with even more entering the market for 2021. So I guess I just highlight that from the perspective of the individual market is getting better. And I think ICHRAs are really exciting. I'm excited to watch how it plays out from the perspective of, as more employers offer an ICHRA, more employees come to the market, which causes more carriers to be interested in offering benefits in the market. More employees, more individuals, better risk pools, more products, better prices, lower premiums. there's just kind of this circle, right? More people come in, carriers get better, which causes more people to come in, which causes more carriers to come in. It's a really exciting kind of wheel to watch turn over the coming years. But to everybody's point, it's super early, so it's at the start, and excited to watch that continue to roll.
Absolutely, absolutely. So glad to finally be able to bring in Chris Rodkey to the discussion. And thank you for being patient, Chris.
Sure.
And Jack was just talking about how not to roll out an HRA to your employee. First of all, send them a note that says we're canceling your group plan without telling them anything else. Yep. Can you talk about maybe beyond that? What are some of the best practices for an employer to roll out an individual coverage HRA to their employees?
Sure. I would draw the parallel to sort of the shift to years ago when high deductible health plans started coming out. You get the sticker shock from the employees because all of a sudden, they're, oh, I'm responsible for the first $3,000 out of pocket. What's going on, right? And I think the fluency around HSAs and how to kind of help employees kind of understand the value to them was important then. And I think it's the same kind of conversation now. I think understanding that you're in control, even though you may have to pay for your health plan and you have to pick the plan and it's not something you're used to. So communication and increased fluency around the tools available. So what is my doctor in the plan that I want to pick? How much money is my employer giving me? Do I need to supplement the ICHRA with a cafeteria plan to cover additional costs, et cetera? Like, these are all things that are very confusing if you don't know what you're talking about. I mean, we kind of take it for granted in the industry because we live and breathe and talk about these 3-letter acronyms and HRAs and all this all the time. But when you go to a dinner party and you say, hey, does your employer offer an HRA? You get sort of these, blank stares, right? Like, what are you talking about? So I think fluency and the tools, so like digital tools, like finding a doctor near you, comparing plans, understanding that the value, we talk about the value to the employer all the time. A lot of folks on this call, very good points on why an employer should pick an ICHRA, but the employee is sometimes lost in that, and understanding the value to the employee. So I think the best practices are, to the best that you can, connecting people early and often with those tools and understanding the value to the employee is very important. It was the same thing with HSAs. And I see a high parallel here, and I agree. This is a time of consumerism, right? And people are not used to being consumers for healthcare, right? They're not used to even shopping for a procedure, let alone the coverage. So I think it's a fluency problem that I would say digital tools, communications via email early and often, especially in COVID, right? Benefits meetings with, virtually to explain the changes. I think those are all, what we've heard from our partners that are kind of embarking on this journey. And I think I would echo what they're seeing out there, that the employees are confused, and getting them for the light bulb to go off for them is the only best practice I see. And all the tools that are out there are the way to do that. So that's how I would answer the question.
Thanks, Chris. And I want to turn to Brad on this as well. I mean, how can, we as industry professionals help employers as they're rolling this out, ICHRAs to their employees for the first time?
Great question. I think as industry professionals right now, I think, it's so important right now. It's, one of our key roles as we get an insurance license is to help educate and to, help guide the consumers to the right plan. So, I think it's that education right now, but I think, the tools that you're providing right now through CMS, what you're doing, the education around this, I've never seen anything like this in my 20 plus years of insurance, that you all are really pushing this so well. And I think it's continuing to do that. Really, I think the messaging is the surprises that I'm hearing when I talk to employers that this is really something valuable. I think that education, more digital, more social media, 2020 has been a little crazy year with everything going on. And I mentioned to people, hey, you might not have heard about this because, yeah, there was some other stuff going on in 2020 in the news, but this is monumental. At least in Colorado, you know, where we see rates different from almost 100% difference from our metro areas to our mountain areas, the messaging now that there is a solution, that there's something different. You know, I think so many employers, so many brokers were marching down and saying, hey, you know, self-insurance and care management and all of these great things that we can do. But I think what employers or brokers who are having success right now are saying, that is great. Once again, we're not in this business. We didn't get in our business to be in the insurance business. They want simple. They want to make health insurance simple again. And I think that message is much more of a relaxed message than when a broker comes in and talks about all of these things. It's overwhelming to employers. And I think that messaging out from an educational level of, hey, let's take back health insurance, let's make it simple again, and walk away from all of the administrative work that you're doing. Give the employees the choice, the freedom that they want in choosing their own health plan. You know, if you think about behavioral economics, employees all have, you know, about 5 different stages of life. It's really tough to have one health plan that's going to fit that. So I think the education around the multiple choices and guiding people from a decision support is really going to be more valuable.
Absolutely, absolutely agree with all that. So, Kat, I wanted to turn back to you. We're getting down the final stretch here of our questions, but Kat, real quick, what are the different ways an employee can enroll in individual coverage in a way to make sure that they are compliant with the rules around individual coverage HRAs?
Yeah, definitely. Great question, Randy. And I think a lot of the panelists have touched on this a little bit throughout our discussion, but I mean, I think a good place to start is just to talk about what an ICHRA compliant plan is. It's primarily mostly an ACA compliant plan. So those plans that are offered through the exchange that have your essential health benefits that you know, don't factor in pre-existing conditions for eligibility, et cetera, right? Examples of plans that are not ICHRA compliant are plans like short-term or sharing ministries, or any other type of supplemental coverage like indemnity, et cetera. So those are non-compliant plans. So I think the best kind of place, and again, a lot of the panelists have touched on this, or the best way to really find individual coverage as an employee is to really go through the state or federal marketplace. That's a great place to start. Of course, there are many other kind of private exchanges like direct enrollment partners, web brokers, et cetera, that provide kind of ACA compliant experiences and plans. So really, it's about showing all plans and prices for individual coverage for the employees so that they can understand their options. And that really does kind of help avoid any sort of steering that could potentially happen that shouldn't be happening if you want to stay compliant, right? Of course, and a lot of folks have discussed this, but in terms of the guidance that will be needed, it's not enough just to send someone to a marketplace to do this on their own for this new benefit. It's just not going to work for the first year or so. So I think that guidance and that support from brokers is going to be key, just as they help these folks, these employees who have historically potentially been accustomed to receiving coverage from their employer at 1 or 2 plans, maybe that's the extent of choice that they've had in the past, to navigating, 70 plus, depending on where they are and what plans are offered in their area. So that is a lot to ask of someone. As Cathy already mentioned, I mean, even for us folks who are in the industry, it's still challenging. So I think, there is going to be a component of assistance and support that just can't be ignored as we think about ICHRA adoption and really providing an experience that helps folks understand, all the nuances, because there certainly are many nuances as you think about what this experience can look like for an employee.
Thank you, Kat. Appreciate that. So, I mean, we're about 10 days out from the start of the open enrollment for the individual market around the country, including state-based exchanges, HealthCare.gov, all the direct enrollment and enhanced direct enrollment partners out there that have built platforms and are offering coverage. And we've talked about the benefits. We're already seeing people enrolling in these plans. They've been doing so, since the beginning of the year. It's, it seems to be saving money in a lot of places for employers. They're making the switch, and employees are learning to, once they kind of figure out what it is, it seems like they're really, liking the experience and enjoying the flexibility and portability. But I want to ask, for our last questions here, for the whole panel, where do you see the future of ICHRAs going? What are your predictions for what we might see, maybe, say 3 years to 5 years out? And maybe Jonas, I'll kick it off with you.
That sounds good. I mean, we're definitely in that early phase. I've talked to a lot of employers, a lot of brokers and consultants, and there's just a large need for education. And so it just reiterates the fact that we're early. And so I think, continued evolution of the individual market, continued evolution of the technology and automation that's available, whether it's capturing attestation, helping shop, decision support. I think the prediction is the growth, right? As those things evolve, the enrollments grow, the employers come, the products change. And so excited to watch it grow. So I just, it's tough to put a finger on an exact number or prediction, but I think growth is simply it.
So Chris, what's your thought? What's your quick prediction?
So I am bullish on it. I agree with the bipartisan nature. I think consumers, and especially younger generations, are used to choice. They're used to getting what is personalized to them. And I am very bullish on the future of ICHRAs. I think as we embark on this change into the ICHRA market, I think that the tools have to keep up. It's only going to be successful if people can kind of have full transparency into what they're selecting, how they're selecting it, and they feel like they're making the right choice for them and their families. So I think that those are the challenges that we have as technology platforms, but I do think that this is the future of health insurance in America.
Annette, I want to ask you, what are your predictions?
I would agree definitely that it will grow. I think it has the propensity to grow because of its flexibility, and that's going to be enormously important coming forward. I think, culturally, people are looking for ways to be more in control of things, anything in their life, and because there's been so much that's been out of their control, especially post-pandemic. And I also think about the changes coming forward post-pandemic with businesses in general. What are we going to do? What are we not going to do? I've spent a lot of time working on visioning with a number of companies saying, what do our customers look like? What do we look like post-pandemic? How does that change our business? How does it change what we do and why we do it? And I think the ICHRAs give, when you're talking about providing benefits, give a lot of flexibility. If my workforce goes more to or the business or industry I'm in is more likely to be populated by a gig worker environment in the future than it is today. This is a fantastic option in order to get those same workers coming back who wouldn't normally be eligible for traditional type benefits. So I think there's nowhere to go but up for its adoption. And I think with the education, that's what will be critical coming forward, the education of both the individuals who are purchasing coverage as well as businesses, and how to bring this flexibility and the desire for people to want to find something that fits their own personal, their own personal story and where they're going and what they need for their families. I think it'll be huge.
Mike Levin, what are your predictions?
So if we break through some headwinds, and there are a number, right? So there is education, which has been talked about here. And for those that are considering, if you go to your broker and they say, no, you don't want to do that, that's just a lack of education. It's a reflection of the lack of understanding of what these products are. But if we can get through education, we can get through the payment icebergs that Jack spoke to. If the carriers start to build more group-like products and networks and plan designs for the individual market, If we can break through these things, and I actually believe we will, I think 5 years from now, we're going to look back and say this was as fundamental a shift to benefits as was the shift from pensions to 401ks. So this holds the opportunity to be something that we'll look at that's generational in scope and change.
Randy, I don't know if it's all right. I'd like to add one more headwind that I think we collectively need to address.
Absolutely, go ahead.
I would say helping employers figure out affordability for those who are applicable large employers. As I think Michael said, choice is good, but it's also complex. I think this is overly complex, particularly we generally work with employers with fewer than 1,000 employees, and helping them navigate what equals an affordable benefit is very complicated now with multiple safe harbors. I think we need to think about simplifying that.
Yeah, and just to add on to that, comment was made earlier, you can go to TPAs and benefit attorneys and brokers. This was supposed to be easier. That sounds that sounds as complex. So you have to kind of break through all that and understand that all these folks are trying to and will be creating easier and simpler experiences for you, the employees or employers.
So we just got a couple minutes left, but John Kelly, did you want to weigh in on your predictions real quick?
Sure. No, I'd echo what everyone is saying. I think we're in the first inning of a 9-inning ball game. So there's definitely a few headwinds coming, but what we definitely see, kind of building off of what Mike said, is yes, all the environment is the exact same environment that you saw back with pensions. So employers, employees want to be better consumers, better aware. They want options. They want choices. They want visibility. That's what technology is supposed to bring, is better visibility. You can buy a car online, but employers are wondering why can't I buy my group insurance? Why can't I see more plans, more options? So the dynamics are there from the customers, the true customers, which are the employers and employees for the product. And it is a shift from, defined benefit to defined contribution, just like what happened with pensions and 401ks. So we're really bullish on it. We're very bullish on it. We think this is, as Mike said, this is the first inning of something that could be absolutely groundbreaking.
Thanks, John. And then Brad, I know you were trying to chime in, and then I want to give Cathy the last word, but go ahead, Brad.
We feel pretty solid for the next 5 years on it. And I think, just from a litmus test of talking to employers, if we talk to our team and the last 10 deals that they went out with, everywhere from a 5-life employer to a 500-life employer, the focus always comes back to ICHRA. And so when, Dean first called me and said, what do you think of ICHRA? My prediction for the future is don't touch it. I think we're right here. You kind of found the sweet spot, and I really like where we're at least here in Colorado. I know other states are catching up, but I feel like you've really hit the mark here, and for the first time in our career. So our really focus on this is, for in the past where our team has led with health insurance, self-insurance, benefits, captives, we've completely changed and continue to for the next 5 years to lead with ICHRA straight up.
And Cathy, what are your predictions?
So a lot of great things said here, but I guess I would like to focus on the employer, right? And I think that I've been in this industry my entire career, and I hear the same things from employers, right? Year over year over year, it really hasn't changed. It's 20 years ago, right? The struggles that employers have. And I think this is an opportunity for employers to start on a movement. I belong to a peer group of CEOs and presidents of other companies and other industries. And I presented this to them, right? So first I set them up and I said, what are your concerns about, health insurance? And we got all the list of the things that were all talked about today. And then I said, I have a solution for you. And their response were, it was a little lukewarm. It was, well, somebody else should go first and I'll do it then. And, So I'm calling out to the employers. The employers have a huge opportunity, for a movement to solve some of the things that the employers have had issues with over the years. And I think if we can get employers on board and get some movement there, then I really think this can be really something significant for the industry. And I think that employers also have to take the time and get educated themselves and not necessarily listen to some of the, consultants and that they've had in the past, because there's reasons that they may not be on board with this. So I'm calling out to the employers. We can get the employers on board. We can get a movement started. Then I think this will be wildly successful.
Cathy, that is a great way for us to close this. Great words there about the future of HRAs. I just want to thank all of you. This has been a great panel. All the expertise and insight that you've been willing to offer today, it's just been wonderful. And I know a lot of people are going to benefit from hearing what y'all have to say. I just want to thank you again for participating, and also want to remind our viewers that you can send your HRA questions to the CMS HRA team at hra@cms.hhs.gov. So that's the email address. It's hra@cms.hhs.gov. So just want to thank everybody again for participating, and hope everybody has a great rest of the day, and hope you stay safe out there.
Thanks, Randy. Thanks, Dean.
Thanks, Randy. Thanks, Dean.